Hello, both sides of the conversation family. We welcome you to this virtual space crafted especially for you. My name is Jada Curry, and I'm both sides of the conversation's marketing director and graphics design specialist. I want to take some time to ground us all as a community into this space we are about to open up in, so let's go through our community standards. Both sides of the conversation is providing a safe and honest space for open conversation, so we ask that you all be respectful of that. We also ask that you be respectful of each panelist, host, and participant. We do encourage healthy debates and conversations. Don't personalize anything with anyone. This includes name-calling, bullying, trolling, or shaming. This will not be allowed or tolerated. Your perspective is yours. It is not a prescription. You do not have to agree, but show respect. These community standards apply to all of our live shows and any virtual spaces that we hold on social media, including YouTube, Facebook, Twitter, or Instagram. We want to make sure that we are caring for each other as a community. This is our priority in all of our endeavors as both sides of the conversation. With that being said, I hope you enjoyed today's show and continue to stay in touch with us via YouTube, Facebook, Twitter, Instagram, or all of them. All right, thank you for listening and see you soon.
Hello, everyone. Welcome to Both Sides of the Conversation. We meet here live every Thursday at 6 p.m. for Educational Thursdays. I am the host for today, Brittany Doyle, founder of Wise Health, and we have a great show in store for you today. We will be having conversations on COVID-19, and we will be hearing from Dr. Noha Abalada from the Roots Clinic. So let's go ahead and get started with our national announcements. We have for today, December 16th, feminist author, poet Bell Hooks, known for Ain't I a Woman and All About Love, dies at 69. The beloved author, professor, and feminist, known for titles, has died starting in the 1970s. Hooks published books that helped shape popular and academic discourse. Rejecting the isolation of feminism, civil rights, and economics into separate fields, she was a believer in community and connectivity and how racism, sexism, and economic disparity reinforced each other. In 1981, she published Ain't I a Woman? Black Women and Feminism, which examines the nature of Black feminism through the lens of sexism and slavery. She went on to write more books studying the topic, including Feminist Theory from Margin to Center, Feminism is for Everybody. Among her most famous expressions was her definition of feminism, which she called a movement to end sexism, sexist exploitation, and oppression. Rest in peace. We also have the San Francisco mayor pledges more police safety measures. On Tuesday, our Mayor Breed announced even more initiatives aimed at curbing open drug use, brazen home break-ins, and other criminal behavior that she says has made a mockery of the city's famed tolerance and compassion. And if you all have seen the news and social media, you know that this city has been off the chain. Mayor London Breed said at a news conference attended by the police chief and other public safety personnel that she would introduce legislation to allow law enforcement real-time access to surveillance video in certain situations and to make it go harder for people to sell stolen goods. She also announced emergency intervention to improve safety in the Tenderloin, one of our poorest and most drug-infested neighborhoods in San Francisco, where parents have pleaded for protection from drug dealers and violent street behavior. The neighborhood contains several government buildings, including City Hall. I know I was walking through the Tenderloin last weekend, and it was a sight to see. You know, it's always been a little sketch over the years, but last week, and I was actually really scared and had to walk through what seemed like the night of the living dead just to get to my car. So hopefully, you know, we'll be able to clean that up real soon, or at least try to start some efforts to move forward or towards a possible solution on how we can get that neighborhood together. Other local announcements that we have, if you want to support both sides of the conversation while you shop online for the holidays, Amazon Smile donates 0.5% of your eligible purchases on Amazon to the organization. All you need to do is start your shopping at smile.amazon.com and choose BSOTC, both sides of the conversation, as your charitable organization, and the donation will be made at no extra cost to you. In addition to that, we also have Giving Tuesdays, which is going on now through February 2022. Go to all of our social media sites for more news on how you can give back to your community and how you can support both sides of the conversation in all of our efforts. A couple of events that we have coming up. On December 17th, we have the Santa's Toy Shop from 3 to 5. That's going to be at the Bayview Y, and that's at 1601 Lane Street. You must register in advance. I know we have a flyer on our website, on our social media platforms, and I know that the flyer also went out in our newsletter, so check that out, and you can click the link to register for this upcoming event. We also have on the 18th, Toys for Tots, which is a toys giveaway at West Pittsburgh Community Church. This is, once again, December 18th from 10 to 2 p.m., 204 Bailey Road, and this is at Bay Point. So that's December 18th, 10 to 2. Next, we have Your Blessing, and SFEG presents Hayes Valley 7th Annual RMC Christmas Toy Giveaway. That's also on the 18th. It's a whole lot of, oh yeah, it is the holidays. December 18th, 2 to 4:30 p.m. And this is on 401 Rose Street. And there'll be a bike raffle, refreshments, and an appearance by Santa. Also on December 18th, that's going to be a fun day. Saturday is a busy day. The kids are going to be booked and busy. We have the Jingle All the Way, which is at the Bayview Opera House, 4705 3rd Street. There'll be a live performance from Mac Mall. Turn up the beat and let me come with some bang bang. So December 18th from 12 to 5, live performance by Mac Mall. Suge's Christmas to Remember, that's on December 19th from 1 to 5. That's live entertainment, vendors, great food, silent auction, games and prizes, toys and clothes. That's at Cafe Envy, 1701 Yosemite. It's going to be an outside event, so dress warm. That's December 19th. Oh, we have a lot of announcements. Thrive City Winter Wonderland by Chase. The Holiday Spectacular. This is going to be at Thrive, and this is also December 18th from 2 to 6 p.m. You can register on Eventbrite. You can look it up on Eventbrite. You can find the links on our social media pages. But once again, Thrive City, this is at the Warrior Stadium. And then we have A. Philip Randolph Institute, APRI, is having their 6th annual Christmas tree giveaway. So it's free trees for all. And this is Sunday, December 19th on Jennings Street, 155 Jennings Street. And this is 1 to 4 p.m. And I believe there was one more announcement that came through. So there's the online screening tool for the emergency housing vouchers is now available. You can get the link again on our sites. These vouchers are for individuals or families who are currently experiencing or at risk of homelessness or recently homeless and at risk of housing instability, whether you're fleeing domestic violence, stalking, human trafficking, sexual assault. There's 73 vouchers that are available, and these are emergency vouchers. So if you go to the link, you can go ahead and register. The deadline will be available. The deadline is January 20th, and it's a first come, first served basis, and they don't have that many. So be sure to register. The link, again, you'll be able to find on our page. Oh boy, is that all the announcements? And then lastly, We have our show that is coming up Sunday, December 19th. We'll be talking to doulas and midwives about the programs that we have here in San Francisco, provide more education on the services that doulas and midwives provide and why it's important for Black maternal health. All right, that was a lot of announcements, but that is a good thing because our communities have a lot going on. So shout out to everyone that is just bringing amazing fun to our communities this season. All right, so let's get into our conversations with COVID-19. We have Dr. Noha Abolada. She is founder and CEO of Roots Community Health Center. She has devoted her career to eliminating health disparities and improving the health of marginalized communities. Through Roots, which is founded in East Oakland, she has pioneered the delivery of culturally responsive whole health and championed the integration of physical and behavioral healthcare, workforce enterprises, health navigation, and mobile medical services to address the needs of over 10,000 members. She has overseen Roots' growth from two-person volunteer effort to a multi-campus, multi-county nonprofit with over 175 staff, which is absolutely amazing. She earned her medical degree, her medical doctorate from Howard University School of Medicine and served as a National Health Service Corps Fellow. We'd like to welcome Dr. Abolada.
Hi there, thank you for having me.
Thank you so much. Thank you for sitting through all those announcements.
They're great.
So I'm gonna go ahead and turn the floor over to you. I know that you have some updates that you want to go ahead and talk about, and then we will, again, just follow up with a discussion and questions and things like that.
Great, well, thank you so much. And I was here about a month ago talking about COVID-19, answering a lot of really great questions from the community. And it's only been a month, but there's already more updates. And we know that with COVID, it's just been like that, where every week, every day, there's something new going on. Unfortunately, the updates are not all super pleasant at the moment with the Omicron variant. And so that is kind of what I want to talk a little bit about today. There's a lot more we don't know than we know, but certainly what we're initially getting back is enough to give us pause and give us concern. And part of that is because what we're starting from. So it's not like we're starting from zero and then dealing with Omicron. We're already kind of in the beginnings of a wintertime surge here in the Bay Area. Certainly other parts of the country, especially colder parts of the country, are full swing in a surge, which is really Delta, is really primarily the Delta strain. And so for another variant to come along and be added to the mix is definitely not welcome news. So here in Oakland and Alameda County, we are starting to see a little uptick. We're definitely not in a situation that a lot of other places in the country are in yet, but that's kind of how it's been this whole pandemic, right? Where Europe kind of starts and then the East Coast and then we kind of follow. And so we are all certainly preparing for a wintertime surge. And now we're preparing for an even bigger wintertime surge than we were before. Unfortunately, hospitalizations are also already ticking up here in Alameda County. And that's one of the things that we're really concerned about this go around, that before Omicron hit the scene, I think we knew we were going to have a winter surge, but we maybe weren't as concerned about the hospitals becoming overwhelmed. But with the Omicron being so much more contagious, even if it is the same severity or even if it's less severe, which I know we're all hoping for, but we actually don't have any evidence, unfortunately, of that yet. So even if that happens, with how much more contagious it is, it's looking like it may be up to like 6 times more contagious than Delta. And the fact that it is getting around some of our immunity is what's making us really concerned that we could still be facing some issues with our hospital capacity. And so that is what we definitely do not want to see happen. And some parts of the country, unfortunately, are already experiencing that with full ICUs. And so that just brings a lot of concern. Some areas of the country are already seeing that Omicron is taking over a little bit. We have some early indications of that even in Florida, because they're doing a lot of wastewater testing. Some municipalities are doing wastewater testing, so they can kind of get a beat on it a little sooner than just from testing, because we know that testing gives us a slice of the picture, but it doesn't give us the whole picture. And here in the United States, we're really not sequencing to the level that other parts of the world and that are actually doing a lot better job at sequencing than we are. So we don't know exactly where we stand, but we're getting kind of this piecemeal information kind of trickling in that we're trying to grapple with and trying to make sense of. But the things that I think are certainty at this point is that Omicron is much more transmissible than Delta, and that it is getting around a little bit some of our prior acquired immunity, whether we acquired it from infection or whether we acquired it from vaccination. It does seem that Omicron is able to break through that a little bit better, or quite a bit better. And so it's kind of leaving us in a situation where I think first off is that, if you'll recall, and this got really confusing for a minute there about the boosters, where they were saying you can get it if you're 18 to 49, and you should get it if you have underlying conditions, and you should get it if you're over. Well, now it's like everyone just is a should, unfortunately. So we've all got put into the should get a booster category because of Omicron, and because that third shot is boosting enough so that we are mounting a more robust response, and it has a better protection against Omicron. It looks like the 2 doses or the prior infection just aren't going to cut it, unfortunately, against Omicron. And so that is sort of now the recommendation has shifted just like that, that quickly, to now everyone is basically in that should category. And so in other updated news, the booster was recommended, a Pfizer booster was recommended for 16 and 17-year-olds. So that was kind of new, kind of happened quickly. Before it was just 18 and up. And so now the recommendation is that 16 and 17-year-olds can get the booster, 18 and up should get the booster. And that is really the vaccine companies have said that they're going to work on a specific vaccine for Omicron, but really the amount of time that it's going to take to do that, if they're going to do it, might just be too long in terms of trying to prevent an actual surge. And so right now, people who kind of do the modeling for a living are noticing that the doubling time for Omicron is really fast. So it's doubling itself like every couple of days, and that is highly concerning. We're watching that happen in other parts of the world, and now it appears that that is going to be what we're facing. And so that puts us at kind of a spike maybe around the late part of January. So we'll just be kind of going up like this. But there's a lot of concern because of, behavior that happens around the holidays. And that's part of the reason why I want to come on this show, both in November before Thanksgiving and now before the Christmas and New Year's holidays, just to make sure that everybody has their questions answered, and to basically be able to bring the information about, really it was about how to gather more safely. Now, with all the uncertainty with Omicron, I think we may even want to reconsider possibly some of our plans. There may be some people we don't want to gather with per se, or that we're going to be more cautious or going to implement more measures. And so I guess the good news about what we're dealing with is, one, is that the booster is looking like it is kind of restoring the protection. So if you get that third dose, then it should restore the protection. The other thing is that all the other things that we've done that are not pharmacological still work, but we might want to step them up a little bit. So you may want to step up your mask situation, thinking about those KN95s or N95s. I know that they are not the most comfortable things, but they are the only ones that actually provide you with that filtration on your face. And so that is something to definitely consider if you're going to be in indoor crowded spaces that are not well ventilated. And if you are going to be gathering indoors, then really want folks to consider getting themselves some of those rapid tests. We have them at Roots. You can email us at admin@rootsclinic.org, and we will connect you with rapid tests. We also now have a large supply that just came in of N95s for the community. And so those are things that we are now giving out because we just want our community to have the best tools possible to combat this enemy that we're dealing with and that is shape shifting and as viruses do. And we have to just be able to kind of adapt along with it. And so that's kind of what we're looking at. I'll just give a quick update on kind of therapeutics because I think that we had a lot of hope in an oral pill for COVID-19. The one that got approved kind of got barely approved because it wasn't so impressive, and so it's kind of disappointing. It only reduced hospitalization and death by about 30%, which is not great. And can't take it if you're pregnant, and can't take it if you're a child, if you're trying to conceive. And so it sort of made the pill a little bit less helpful, but maybe for some people it might be helpful. Right now, the only other outpatient treatment that we have is the monoclonal antibody treatment. Is a good treatment. It's an infusion treatment. We are now learning how well is it going to hold up against Omicron. It looks like several of them are not holding up against Omicron, unfortunately, but there may be at least one that may be. And so we're still saying that if you do test positive for COVID and you have symptoms, that definitely please ask about monoclonal antibody treatment. We still find that not enough people in our community know that this treatment exists, and it can be a lifesaver. It's reducing death and hospitalization by 70 to 80%. So that's quite significant, quite a bit more impressive. The only thing is that it is an IV infusion, so you do need to take, a couple hours out of your day, but that could keep you from weeks or longer in the hospital and even from death. So definitely well worth it if you can get your hands on it. And we've certainly made a lot of those referrals, and we know we're saving lives doing so. And so that is still, so far, that's still a tool in our toolkit. The other thing to maybe mention is that those monoclonal antibodies used to be for 12 and up. They've recently been approved for newborn and up. And so that means that for some of our young children, because we know that even though most children do okay with COVID-19, there's a group that progress and don't do well. And so these are mostly kids with, they may have underlying conditions. They may be overweight. But they may have just only a mild case of COVID and then progress poorly. So it really is important to test. So whenever there's symptoms, even if they've got a runny nose or sore throat or whatever, go ahead and get tested. And I really am recommending that everyone, if you can, have rapid tests at home so that if you wake up or your child wakes up not feeling well, you can do the test, and that if it's positive, you can believe that result. So that's really important. If it's negative, you still may need to follow up with repeat testing or PCR testing. But if it's positive, then you know what to do. You ask about treatment, you isolate yourself, you contact anyone that you've been in close contact with, and so on. And so I think that's good for an update. Hopefully we'll have questions, and I'm happy to answer any questions that we might have.
Thank you so much. You said a lot. My heart, I'm not gonna lie, my heart sank when you suggested that we don't gather as much, right? You say not as much over the holiday. So can we talk about that a little bit more of what do you recommend? Like how, we've sacrificed, well, this will be the second holiday that we'll be sacrificing, being around our families and things like that. Do you have any suggestions? Like if people do come together, like how many do you suggest? Like what type of practices, should we keep on going with, or how should we holiday this year?
I know, it's a great question. And I'll preface it by saying we all have different considerations, right? And we also all have our own risk tolerance. So I may be more conservative. I won't be gathering outside my bubble. If I do, it will be outside with tips and outdoor heaters and whatnot. And that's just my comfort level. So, but we each have to think about, I think, a few things. So I think the first thing to think about is, what is your risk of doing poorly if you catch COVID, right? So how much risk do you want to take with that? If you're young and healthy and you're triple vaccinated, that's very different than someone who's, maybe older, maybe has an underlying condition and maybe only has 2 vaccines, or maybe is unvaccinated. So each of us has to think about, what is my risk of getting COVID? And then what is my risk of doing poorly if I catch COVID? So if you're not vaccinated, I would not be traveling at all. I would avoid travel unless you absolutely have to. And part of that is because you have to think about the traveling itself, but also what happens when you get your destination, the chances that you'll bring COVID to someone. And that's the second thing I would say to consider is how likely are you to then give it to someone who won't do well if they catch COVID? So if you live alone, let's say, and you don't go around anybody without a mask on, then you may gather and then just go home. And then, when you need to be around other people, you're wearing an N95 mask, let's say. But if you live with someone who's vulnerable, let's say you live with a 4-year-old child who's unvaccinated, or with an elder who may not have mounted a good response to the vaccine, you're with them in the home all day, the chances of household spread are high. And if you have someone in the household that's vulnerable, you might not want to go to that gathering because you may do okay, but maybe that person will do okay. So I think those are all things to think about. If you're going to gather anyway with people outside of your bubble, then I do think there's some things to think about doing. One is kind of assess the space. So how well ventilated is the space and how crowded is it going to be? I know that there's been times when I've had to go do something inside and I'll kind of look around and be like, where's the open window? Kind of sit by the open window or kind of halfway in the doorway or whatever, depending on the situation. So how good is the airflow, the air exchange, the ventilation, and how many people are in the space? Because after a while, even if you're all wearing like a cloth mask, whatever, you're all going to be breathing the same air at some point in time. So that's kind of the second thing to look at is how long are you going to be there? If you're just stopping in and you're going to be there for 30 minutes, that's one thing. If you're going to be in the space with the same people for hours, you will all be sharing your air, at some point.
Right.
So let's say you're doing that. You're going to be in an indoor space with people outside of your bubble. You don't know if they could have it or not, and you're going to be together for hours on end. That is when, and people don't love this, but that is when I suggest two things. One is the rapid test. If you take a rapid test right before you walk in the door, it's going to tell you if you're contagious. It might miss some, so it's not perfect. It is a rapid test. It's an antigen test. It's not the gold standard. It's not the PCR test, but you can do it up to the minute. You can just do it right there in your car. And if it's positive, you don't go in. And if you're the host, maybe everyone has their comfort level, right? I mean, we've had to have very uncomfortable conversations and getting all in people's business if we want to be around them with COVID. And that's just kind of part of our new, like, if we want to socialize, we're having to ask people all kinds of
questions. Who are going to be there? Who are going to be there? That's my favorite question. Who are going to be there?
Who's going to be, and you don't know. So if you don't know their whether you know their vaccination status, if you know their vaccination status, if you know that someone's not vaccinated and they're going to be there, I understand being more concerned. But I would have to say that with Omicron now we're seeing, and even with Delta, there can be breakthroughs. And so you can still have it. Now you'll be less contagious. And that, that's the thing. So with the antigen test, if you have a lot of COVID in your nose, it's going to tell you. And so the most contagious people, let's put it like this, the most contagious people will be weeded out by your rapid testing. So if you get everyone to rapid test before they go in and everyone has a negative rapid test that's inside, you have dramatically reduced, I think, the chances that you have a contagious person inside of the event. And so I think that that's probably what I would do if I was going to be having an indoor event that I didn't know everybody's background status. The second would be keep a guest list with the contact information, because if someone does get it, those are not fun calls. I can tell you from people that I've talked to, it's like, ooh, I gotta call these people. But you want to make those calls because you really could save a life. I mean, you really could. And so not only could those people get treatment potentially that could be life-saving, like I mentioned, the monoclonal, but then they can also not go around and expose other vulnerable people. And we know that sometimes these single events, and they've traced some of these events where one person going to a wedding results in 300 something cases, 10 deaths. I mean, we've seen these, and these are really just very devastating situations that we want to avoid to the best of our ability. So I think all of these layers are things to be considered. Now, if there's an indoor-outdoor kind of venue event, you might want to, okay, I go inside, I put my mask on, then I go be outside, or I kind of, take a break. I mean, those are all things I think that are worthwhile. the last thing I'll say is that if it's an indoor venue, you can have a little CO2 analyzer. It's not perfect, but it kind of, oh yeah, I take mine where I go.
Oh Lord, these are doctor moves right here.
And so, you can kind of get an idea. I mean, if it's 500, 400, 500, you got good air exchange, and so but if it's getting up to 1,000, 2,000, and sometimes, if it's getting up to 1,000 and 1,100, sometimes you can just pop open a window and you'll see it start to come down, and that's just make you feel a little better, like, okay, I'm doing, so it gives you information. It definitely can't tell you if someone has COVID and if there's COVID in the room. If there's no COVID in the room, it doesn't matter. If there is COVID in the room, it does. But I think it's something that can especially if it's your home and you're hosting, play with it a little bit. Like I know that if I open this window and that door, then I've got a nice air exchange. But if everything's closed, maybe not so much. And if you have central air, if you have HVAC, please invest in a good filter. Some of those filters are gross, and some of them are filled up and they're not working. And some of them don't fit well, so the air is just going to go around. So you need a HEPA. You need at least a MERV 13 filter or a HEPA. So if you're hosting at your home, please take these extra precautions as a host to think about your air circulation and filtration.
This is important. That when you're living in like an apartment building, you're supposed to be changing your filter out. I want to say like every month or like every 2 to 3 months. And of course, the apartment building doesn't tell you that because they have to do the actual work. But those filters for your AC or for your heater in your apartment are supposed to even be cleaned out on a regular. So be sure
it's time for us to have those, like I say, those uncomfortable conversations. Is this being maintained? This is about our health and safety. And so they're not always easy conversations to have. Of course, you're not going to walk into the restaurant and be like, let me see your HEPA filter. But, if it's the place you live, absolutely. Just like we would advocate if there was mold, we advocate if there's poor quality air. Indoor air quality is something that we have not paid enough attention to. And I would say that now we need to, and even during this pandemic, we're not paying enough attention. But before that, we really were looking at always energy efficiency, right? We want to do the most energy efficient thing. And as a result, I know you've probably experienced this. I've gone into buildings where I'm like, I don't feel well. Like it's making, after a while being in this building, like that's a sick building. You've heard sick building. And what that is poor air ventilation and accumulation of CO2 and sometimes other chemicals and things that can't get out because we've made it so energy efficient. So in some ways, we're having to dial some of that back and say, you know what, actually, we need good ventilation. We need to be breathing as clean of air as we possibly can. And so sometimes we do have to kind of check on what it is that the property owners might be doing and ask some of those questions.
Right. And you were saying that these are tough conversations to have, but it's really important because, as a community, we have to at some point start focusing on moving forward. Like, we're aware of what's happened in the past, the disparities and everything that has been brought up to the light. We understand the health inequities, and we saw it with access to testing and to the vaccines and all of that. But now it's like, as a community or even as a household and as an individual, like everyone has a responsibility on what it looks like, on how we sustain our community and move forward, addressing the health of our community and just moving forward with life, period. And so I hear you say over and over again, having a test in your home, having a test at the job. And, and even though it's something so simple, but that's so important because just even the simple act of not having to leave the house to go search for, testing sites and stand in a long line when you now can easily just DoorDash or have it at your house, and just be prepared to swab people when they come in your house, or be prepared, incorporate this as a weekly, thing, swabbing your nose to make sure that you're in the clear, and we just had this conversation about just even changing the filtration systems and paying attention on, how you're breathing in spaces and stuff like that. But are you seeing anything else in our communities? Or are you seeing anything or noticing anything that we need to do to like move forward? And that's even like technology, like increasing access, but you're there in the trenches and you see what's going on in the community. You see the trends and the needs and all of that? And is there anything that you would say that we can do, start making those changes to move us forward, besides what you've already said?
Well, yeah, I mean, I know we've all heard this, and so is that we still have a lot of people in our community that aren't vaccinated at all yet. The average in Alameda County is at about 78% of folks fully vaccinated, but when we look at the African American fully vaccinated rate, it's 62%. So that's like 16 points difference. That is major. And so what that means is that when we get another wave, we're going to lose more people. And that's what worries me the most. And so the conversations, I think have gotten really confused and confusing, because a lot of times what people are talking about is the public health and politicizing everything and making it about something. Well, really, it's about you. What do you need to do for you and for the people you love and the people that are around you? And it can be hard to sort through everything, but that should be our only priority right now. If you are just any individual, what can I do to make myself and my loved ones as safe as possible? And if you haven't already spoken with someone you trust, if you don't have a physician you trust, please get one. I think one of the biggest things I've seen is that a lot of folks in our community do not have a physician they trust. And it's not just for COVID that you needed this way before COVID, right? But now it's even more so, because now people are getting information and advice oftentimes from sources that don't even mean you well, or that want to prey upon your legitimate distrust and exploit it and monetize it. And all of that is happening, where there is so much profiteering going on in so many different spaces, that I think we have to really be smart and smarter than that. I mean, we know better, right? We know, and we also know that we deserve the best of the tools that are available. And so my first and foremost concern really is for those who've never had COVID and never been vaccinated, you still don't have any antibodies against this thing. And so if you catch it, it's still a roll of the dice on how you're going to do. And this has been one of the most frustrating viruses like ever, because you can't predict who's going to do bad. I mean, there's nothing else I can think of where it could just kill you no matter what age you are. I mean, obviously we know that elders do worse, but we've lost children, teenagers, 20-year-olds, 30-year-olds, 40-year-olds, people in tip-top shape, people who, take all the herbs in the world, people who go to church every Sunday. I mean, we've lost all kinds of people. And there's nothing that's going to be foolproof. Even the vaccine is not foolproof, but it is dramatically reducing your chance of dying or getting severely ill and going to the hospital. And I don't want to lose any more people. We've lost too many people already. So the biggest thing would be, everyone's worried about boosters. People are rushing for boosters, but we still have a population that have not even had their first vaccine yet. Here in this country, here in Oakland, here in the Bay Area, worldwide. I mean, there's places in the world that haven't even seen their first dose. That's a travesty. I mean, those are things we should be collectively fighting for, is global vaccine equity. So I won't go too far off on that tangent, because I know you were asking about what can we do right here. So I think first is talk to folks and, really hear them out, ask them what, don't, it's okay to have personal boundaries. We all have to have them. I can't hang out with you like that if you're not vaccinated. I'm just not going to, because I'm risk averse. Like I said, I'm not trying to expose my people or myself. I don't want COVID. I don't want long COVID. I don't want any of it. So we can't really hang out like that. If you're not vaccinated, we can do something outside, probably something like that. It's good to have those boundaries. But to cut people off completely and not talk to them anymore, which we've seen a lot of just a lot of really hard things happening in families and friends. That's hard. And that means that we're cutting off the conversation. So I would think we should all have grace for one another, love for one another, ask, what is it? Because every day people are changing their minds and getting vaccinated. And so we should not just give up automatically. The one that worries me the most is I'm still hearing pregnant women saying that they're going to wait till they deliver the baby. And that does worry me. And I understand why women feel that way, because, I didn't want to put anything extra in my body when I was pregnant. So I get it. But what we're seeing right now is that the risk for pregnant women to have to go to the ICU, of the baby doing poorly, is about double the rate and is very, very concerning. And so waiting until after the baby may be waiting too late, especially with how contagious this new variant is. So I would just urge pregnant moms, please, speak with your doctor, look at, there's a lot of information out there. Basically catching COVID could be devastating for you and your baby, whereas the vaccine has not shown any adverse effects on the pregnancy at all. And so we really want pregnant moms to, really, really, it's being now urgently recommended by all the societies, all the associations that look out for pregnant moms, whose entire purpose for being is to protect pregnant moms. They are all urgently recommending the COVID vaccine at this point. And so it's something to really take heed to, because that has evolved over time as we've learned more. At the beginning, it was like, you can get it if you want, but now it's like urgent, get it. We know enough now, you need to get it. Yeah.
Yeah, it's definitely been a concern, but then you haven't had a lot of people talking about it, specifically focusing on pregnant women and breastfeeding women. There's definitely been a lot of concern around that. I know on a previous show, we were talking about, does an infant receive any sort of immunity through breast milk, from a vaccinated mother? And that was definitely a floating question for a long time, the effect of vaccine, a vaccinated mother and the impact it has on a breastfed child. Can you speak a little bit more about that?
Yeah, I think I want to start out by saying that this is a problem in medical research across the board. Pregnant and nursing moms are often left out of research and of recommendations and are marginalized in their own way. And it's understandable in the sense that you have an ethical challenge trying to do research or study upon a pregnant mother, because it's not only about the mom, it's about an unborn child. And we always would want to be very careful and not experiment, or anything like that on a pregnant mom. And so that is why pregnant women were not specifically enrolled in the vaccine trial. And it's why pregnant and nursing women are often excluded from medical research. And so it sounds reasonable. We understand why it's hard, all of that. But what it results in is that we don't have great, solid data to make solid recommendations. And the only reason why we have good data now about pregnant women is just because of the magnitude of the event we're dealing with here, where now hundreds of thousands of women have gotten the vaccine, and we're able to look on a population scale and say, there's no difference in maternal outcomes for women who get vaccinated. There's no difference in fetal outcomes. And so we know that is safe. There is some immunity that happens from a pregnant mom to the fetus when the mom is vaccinated while pregnant. Whether there is, I think it's still not quite known whether there is going to be some passive immunity that goes to the baby through breast milk, but we know that in general, babies receive all kinds of antibodies from mom that are positive and beneficial and help the baby to be protected against disease. And so certainly mom getting vaccinated in pregnancy and nursing is going to be the best possible outcome for our babies. That's about as much as we know right now. And I know there'll be more that, but as we've seen, women's health stuff, and moms, all that stuff ends up, lagging behind. But these are the kind of things I think we should be, as a community, outraged about. We should be advocating around. We should be saying we need to make sure that women are considered early in terms of, research. And I think there's a lot of things that we need to be advocating for to go right with this. I think we have a unique situation here where we have so much data now after the vaccine that it's really hard to make an argument against getting it for almost anyone. I mean, there really is not any real contraindications to getting it. And at this point, you would be denying yourself the one tool that we do have that could reduce your chances of hospitalization or death. And that's what I just hate to see. I hate to see it. I hate to see, because now when anyone dies from COVID and they weren't vaccinated, it's just even more tragic to me, because it's that was vaccine preventable. That, there was no reason that we had to lose that person. And so it's just getting harder to grapple with it or accept it, because it was something we could have prevented, and we don't we don't like that. Yeah.
Right. And so I feel like that's a good segue into, talking about vaccinating youth. I worked on some efforts here in San Francisco where we did like focus groups with youth to see, where they were with getting vaccinated. And this was before they even, released the vaccination date for them. And a lot of youth were not going. Medical mistrust is really huge here in the communities, all communities of color, but on different levels. And a lot of times, it's influenced by the parents, Instagram, everything that a lot of before where the influences, take control. And I'm just curious on what were your experiences on vaccinating youth in East Oakland?
Yeah, a lot of the same. I mean, I think I think in general, communities of color, but also particularly youth. And just, it's like, you haven't been talking to me all this time about health. Why are you trying to talk to me about it now? Right. So it's understandable. And so we've been talking to you this whole time, and there have been other people who've been talking to you this whole time, but the government hasn't been. There was no incentives for me to go and get, whatever else done to get my well child exams, things like that. And so now all of a sudden you want me to go get this vaccine. So I think there's been this real kind of mixture of people feeling like I'm getting over bombarded with messaging about this particular this one thing, COVID, when I've got all these things, first of all, going on in my life. And you never cared about my health before. So now why do you care? You're probably gonna make money off it. And all that can be true. All the things can be true at one time, right? I think that's something that we have to start to realize, is that many things can be true at once. Pharmaceutical companies can be making a lot of money. And the government could have never talked to you about the health before, but they're talking to you about it now because it's a pandemic. And because they might not be worried about you particularly that much. They're worried about the population, the spread, and all of that. And we all should be caring about that, because we don't live here on our own. We're not on this planet by ourselves. And that's one of the things that's been really hard about the United States kind of response, is like everyone for themselves. And we all go down like that in a situation where our enemy is mutating and staying a step ahead of us this entire time. So we either have to get it together, or, it really is a situation where it is everyone for themselves. And so, but I think there's also this piece around, your individual risk. And I think that's the part where I worry that not enough people, are those young people going to their doctor that they trust and asking them, what do you think I should do? What is my risk of doing bad if I get COVID? What is my risk of doing bad if I get the vaccine? Are we accessing that expertise? Because every one of us deserves our own primary care doctor that we can go talk to and make them stay longer than 15 minutes. Don't let them get off easy with the 15-minute visit. If you got 30 minutes worth of questions, then they're going to be behind that day. It's okay. You have a right to that. And I don't think we all think we have that right. And if there's any one thing I can say out of all of this, is that we need to exercise that right. Especially, I mean, if you've got, if you're assigned to a provider and you don't go for years on end, I mean, you're not accessing and availing yourself of information. And if you don't like that doctor, switch, just find until you find one that you can trust and that you can talk to. And I think that will go a long way, because you deserve your own expert in your corner. And that's what that's supposed to be. And so I think that would be the other thing, is that a lot of it's got mixed up between the message that is going out to the public so that we can, reach a threshold of immunity and create an immune wall, so to speak, against this thing, versus the individual. Because I think that a lot of the messages, oh, young people do fine. Well, most young people do fine, but some young people don't. It has made it into the top. It's the 6th leading cause of death for our young people now. So it's not a benign thing. And kids aren't supposed to die, right, of diseases. Kids are not supposed to die of diseases. We're supposed to be a developed nation or whatever. And they're definitely not supposed to die of vaccine preventable diseases. And so, which is what this is becoming, a vaccine preventable death, essentially, COVID. And so I would say that, I feel like young people in particular, if we're not talking to our young people about all the things that are important for their health, about nutrition, about exercise, and about, being safe and about reproductive health. And these are the things we've been doing for years at Roots. That's what we do, right? So we have those trusted conversations with young people, and they know that we're not going to just be like popping up like, oh, you need to get a vaccine. We've never talked to you about anything else before. No. And if that's all that youth have had, then that's the problem. So we as society need to really look at the fact that if we haven't made it clear that young people deserve access to education, to preventative health care, maintenance, then we failed there. And it's no wonder that they're like, I'm not really too sure about what it is. I'm just hearing on the 6 o'clock news. I mean, like, no, that's not going to do it for me. And that's understandable. Any reasonable thinking person would have those questions.
Right. Yeah, I agree with all of that. Yeah, it's just it's starting to be like it's starting to take a different approach, especially when it comes to promoting vaccines, promoting testing, promoting prevention. And I know that a lot of people now are like looking for something different. I mean, new information, new signs, new something. I know a lot of people are looking for something different. And I'm just wondering, I don't know in your role if you specifically have a hand in like promotions or just like discussions or education, but I'm just wondering, what do you think about coupling like COVID with another, how can I put this? Coupling, like when we're talking in the conversation of talking about COVID, COVID works hand in hand with a lot of, other underlying diseases. When people have pre-existing conditions, illnesses, immunity deficiencies, and things like that, when you get COVID on top of that, a lot of times that's what takes people out. Even though I heard you earlier say that, you don't really know, it's very tricky. You can't really tell who it's going to take out, who it's going to impact more and things like that. But when we're having a discussion around COVID, are there specific diseases that we can talk about, in addition to COVID, just to make that impact greater, just for people, to drive it home? Like, if you already are suffering from this, you don't need to get COVID. You need to, focus on this. You need to get vaccinated. But are there conditions and diseases that should be in conversation with COVID right now?
Yeah, I think it's a great question. And I think that, yes, absolutely. And sometimes these are hard conversations, right? Because one of the things that we've seen is that COVID is not just like a respiratory illness, right? It's actually setting off an an inflammatory response, basically, that can affect all the organs in the body. And we're seeing a high correlation to overweight, especially with children, but also with adults. And it's hard to talk about, maintaining a healthy weight because it's hard to do, right? And especially when you're sheltered in and, all this other stuff's going on. We know that weight gain during the pandemic was quite significant. We saw it a lot in children and adults. People were more sedentary, more stressed. Alcohol consumption went up. Other substances, even relapses, all of those things, depression, anxiety, all of the things that don't serve us well if we're trying to fight infection, right? So I think talking about just healthy lifestyles in general is actually really important. Maintaining a healthy weight and what that is, what that means, how to eat a healthy, balanced diet, how to not be vitamin deficient. And so we don't want anyone to be vitamin D deficient, zinc deficient. These are things that we might not think about these things all the time. And, some people don't, argue with me about like, vitamin D is not going to cure you. No, it's not going to cure you from COVID. But if you're vitamin D deficient, you will do worse with COVID. That has been established. And so there might be some debate about how much you're supposed to take and blah, 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 but we don't want you to be vitamin D deficient. That is absolutely the case. We don't want you to be zinc deficient. If you drink a lot of alcohol, you may be zinc deficient. So a multivitamin, vitamin D, eating healthy, getting good exercise, keeping stress, at bay, a good night's sleep. Man, I can't say how important a good night's sleep is. There have been studies that show that if you're sleep deprived, you are more likely to catch viral illnesses and do poorly with viral illnesses. So there has been suggestion of even melatonin if you don't sleep well, thinking about melatonin to help you get a good night's sleep. If you catch COVID, that's something to consider along with the vitamin D, the multivitamin and zinc and all of that. So I think that there's some just healthy living things in general. Now, in terms of underlying conditions, I mean, one of the biggest things when this first hit, it was like, I could not believe that hypertension, high blood pressure was going to be an independent risk factor for doing poorly with COVID, because first of all, that's very unusual. But now we see that it probably does have something to do with this inflammation and with the veins and the vessels and things like that. Because before, we really didn't understand it. And certainly diabetes, we know not only is diabetes a risk factor for doing poorly for COVID, we're seeing a lot of new onset diabetes happening after people catch COVID. So that burden of illness in our community, unfortunately, that is what we're all sort of preparing and bracing ourselves for, is that we're going to have more diabetes to contend with in the community because of COVID. And then also people who had diabetes, had high blood pressure, caught COVID, did poorly. Now you've got pulmonary lung scarring, you've got heart damage, you've got all these things like long COVID. So on top of everything, I think we need to be, unfortunately, I think we need to also be talking about, how prepared are we for all of the disability and chronic illness that COVID is actually causing. So there's so many parts I know to what I just said. But I think for me, what has been surfacing the most in terms of pairing the COVID conversation has been around the mental health impacts, and it has been around the increases in violence that we've seen during the pandemic time. And it has been around just a healthy lifestyle in general, just paying attention to having a healthy overall lifestyle and balance within your life. Because if you put COVID on top of you're eating poorly, you're drinking, all these other things, you are much less likely to do okay if you catch it.
I feel like that all of that is just really good information for people to hear, because it's like, I know there's a lot of people that are lost, that are like, well, dang, I've been washing my hands and wearing my mask. Like, what else is there that I could do? Go out for a walk, eat well, stay on top of your health.
Keep those stress levels down.
Yeah, work on that mental health, that anxiety. But that's all important, when we're talking about, what it looks like moving forward and how you have to start with the individual. Those are those individual moves that, that we can make, that will, when people start to see you or, making those changes and living that better lifestyle, then they'll want to do the same too. And so as the individual, you can impact the community, be the leader and just, show what it looks like to move forward with a healthy lifestyle, and other people will do the same. So thank you for that information. That's a really good tidbit to end it off with. And so, as we wrap up, this whole entire time you have been giving like amazing tips, updates, information and education, but, is there anything else that you think that I didn't ask or we didn't bring up that you just want to bring up? Any tips, any more suggestions, what would Dr. Noha do? Because that's what we need to know.
Right. Well, like I said, I think this is always a time where we have time off, we have time to reflect, we have time to be with family. I think we want to continue doing the things that we've been doing to keep ourselves safe and keep our loved ones safe. And even if we decide that we want to make a trade-off, I think it's okay to make a trade-off, but let's do it with our eyes wide open and say, you know what, I really need to see this person and give this person a hug. But how can I do it safely? Maybe we're going to do tests beforehand. Maybe we're going to quarantine first and then make sure it could be extra safe. There's a lot of measures we can do. So we shouldn't be thinking of it in terms of all or none, or just, I know we're all fatigued with this. There's no question about it. But we're still with it, and it's still an evolving situation. And there's still a lot of uncertainty and a lot of unknowns. So I want people to hang in there, and, and if you're making trade-offs, that's okay, but let's just have our eyes wide open about it. Let's be in communication with one another. I think what has happened that has torn families apart is when people weren't honest with one another, exposed someone maybe died, and now that is something that family will be living with for maybe generations. And so those are things that we want to keep away from ourselves and we want to protect ourselves from. And so I think communicating with one another, being open with one another, and maybe sacrificing. For some, it's going to mean sacrificing and doing something smaller, doing something outside, doing something with fewer people or for shorter time periods. And so I think thinking in terms of maybe not always all or none, but how could I do this better? How could I do this safer? What more things could I implement? On our YouTube channel, which you can follow, we put a lot of really short videos. We have 2 short videos we just released that are about COVID safer gatherings. So one is about indoors and one is about outdoors. Of course, the outdoors one is real short because you can relax outside. There's not a whole lot, there's not that much to worry about outside, but you still got to be careful depending on what your activities are. But certainly for gathering indoors, we really want to be careful. This is probably, I hate to be, this is probably not the time to have a large indoor crowded gathering in a poorly ventilated space. I'm going to go ahead and be that wet blanket and say, don't do it. But, short of that, scaling it back some, doing the testing, upgrade your masks. I think this is the time to go ahead and find you N95 or legit KN95 that fits you well. There's not big gaps everywhere. And use that if you're going to be in an indoor crowded environment, especially as we move into this winter surge, which is kind of inevitable. And then definitely, if you get any symptoms, don't brush them off. Get tested because you might be able to get a life-saving treatment. So get tested right away if you have any symptoms. And just stay safe out there. And I think this is a great time for reflection. It's a difficult time. There's no doubt about it. It's also a good time to think about what it is we're grateful for. There's a lot of things that have happened during this time that have been positive. We've learned new skills. We've made new friends. We've had new relationships. We've I think, developed new coping strategies. We've managed to be closer with some people we might be sheltering in our bubble. So I think it's also a great time to just think about what are the positives. What are the positives that have come out with it? And I think some of us will be surprised when we really start to list them out. That there are some really positive things that help balance it all out. And so I think I'll just end on that note about being balanced, and let's just keep the balance because it is very tumultuous out here.
Yeah, so important. Thank you so much for all of the great information. I just have one more question that is non-health related, just for anybody else who's watching. What kind of plant is that behind you?
Ooh, I don't know. I can't even take responsibility for keeping it alive because my husband I kill stuff like this. So
like that, the plant looks happy and healthy and it's gleaming back there. So I'm gonna have to look it up.
I've been on meetings where people know the name of it, and I guess I should find out. I'll find out. I'll know next time.
You have to keep it on a Post-it because I know other people are going to ask because that plant
not the green thumb in the house.
Well, thank you so much for your time and just for all of this great information. And just have a wonderful evening. And I know we'll see you back on the show again real soon.
Thank you. Thanks so much for having me.
Thank you.